You
Right.
must put yourself first sometimes, not all the
Right.
time, but sometimes we have to be first as we take care of our own health.
I see trees of green, red roses too. I see them bloom for me and for you. And I think to myself, what a wonderful world.
Hi, my name is Sandy McGatha, and we're meeting today for Mental Health Awareness Month for the month of May. And this is our fourth video on diversity and inclusion. And today, as a special guest, I'm excited to have Richard here. He is with the Castlewood in Nixa. Richard, my background is a licensed clinical social worker. So I've been a licensed clinical social worker for about 15 years. And I worked my background is in adult inpatient psychiatric. I was a director for a psychiatric unit for several years. And then I went into outpatient and did outpatient therapy in a community mental health setting. Can you tell me your background? Because I think it's pretty impressive.
All right. I was a professor of psychology at the University of Nebraska in Omaha for 29 years. I also had a private clinical practice. I was co-partners in the Omaha Consultation Center. Then I was also on the staff of the Clarkson Memorial Hospital. In addition, I did some work, forensic work with one of the units out in Sarpy County. I was on the mental health board there.
Wow, that is so cool. I'm so glad to have you here today talking about self-care, because I know that you probably know how important self-care is for our mental health, for our well-being.
Absolutely.
So one of the things that we've talked about so far in our diversity and inclusion, we've talked about depression. We've had a series we've had a video on anxiety, and we've also done grief and loss. So this is the importance of what it's like now to take care of ourselves, not only as we're young, which is important, but as we age, how we care for ourselves and maintain, because depression shouldn't be something that we accept as the norm as we grow older. What are some things that you would recommend to others about self-care? Do you have any ideas?
Well, sure. Obviously, anything that a person does to improve their physical, mental, and emotional being is important. And that would include, of course, eating well, getting plenty of sleep, walking. If you have a dog, walking the dog, taking exercise. Anything that you can do to improve your own well-being without having the help of some other healthcare provider.
Right. I think we sometimes forget to take care of ourselves, and instead we get caught up caring for others. And as a professional provider, like I know that you are, you probably learned early on how to sort of maintain enough for yourself, even as you gave part of yourself away to other people as a caregiver and listening. It's when you listen to other people's stories, sometimes that takes some energy, doesn't it?
Yes, it does.
So we protect ourselves a little, but we also learn, I know, from that. I also think self-care is so unique to the individual. You know, my self-care might not be your self-care, right?
That's true. Yeah, you may not have the same needs that I have.
What are things that you feel that you specifically do about self-care for you?
Well, I have some things that I do and some things I probably should do.
There you go. Good for you. That's true.
One thing is I have a walker because I'm a little unsteady on my feet, but I don't always keep it near me. As a result, I fell the other day. So that's one thing. I need to stay a little closer to my walker. On the other hand, I do eat well. I do give 8 or 9 hours of sleep every night. And I try to exercise some by walking and doing simple exercises in the home.
Yeah, very good. So good point you just made. Oftentimes we do know things we should do, but we don't do them. I'm terrible about that because I don't eat as well as I should. So
Right.
I tend to not eat as nutritionally as I should. And I know better, but I tend to be a little indulgent. So good recognition.
Yeah. We're fortunate here at the Castlewood because they do have the dining room and we can go down and get food. And if we don't, it's our own fault. So, but Marjorie isn't always able to go down, but if she doesn't, I go down and get food and bring it back so that we do eat well.
So Marjorie is your wife, correct?
That's correct.
And she is also a doctor of psychology or something
Yes,
else?
that's true. She taught some, but then she went into administration and was dean in the Arts and Science College there in Omaha.
What wonderful contributions you all have made to the education and the caring of others. Thank you for doing that. That's a real gift.
Thank
Let
you.
me ask you this. How would you know if you needed self-care? Do you have any ideas? I have a few ideas. I'm curious if you would recognize when we know we're getting low and we need self-care.
Yeah. I'm not sure everybody is aware when they have needs. Or if they are, they ignore them. Obviously, if you're not eating, then you know better. But a lot of people will just eat snack foods or quick foods, and they know better, but they're not
That's
doing
me.
better.
That's me, right? Sometimes if we get irritable or if we're kind of down on ourselves, if we're exhausted, weary, that's a good sign that we probably need to take a little time for ourselves, I imagine.
Yeah. Yeah, that's a good point because sometimes we're so busy taking care of the needs of others that we're not taking care of ourselves. We're working long hours or spending time with others, whereas we should be taking care of ourselves.
Why do you think it's so hard for people not to spend time on themselves? Do you have any thoughts about that?
No, I think it's just a lack of tuning into themselves. Obviously, they're just so busy doing other things that they're ignoring probably the signs that they should be seeing that they need to be taking care of themselves.
Right. It's easy to do that, ignoring the signs.
Right.
And that's why I liked what you said about the walker. We kind of know those things, but it's about being disciplined enough to do them. I think women tend to be caregivers and they tend to give all their energy away and they forget to care for themselves. And men are often busy, like you said, working. They're out on the job. They're taking care of all the things in the household, outside in the yard, and then they're also working and making money. So we get into these kind of patterns or behaviors, and before we know it, we've kind of exhausted some of our resources.
Right.
One of the things when I would talk to people about replenishing themselves, it's actually a little more than just going fishing, although it is important to go fishing. It's about being consciously aware that we are depleted and then taking a moment. Some people do meditation. Some people might do mindfulness or garden or sit in the sun. When you used to practice, I imagine you also did you do testing as well?
Yes, I did. That was one of my fortes.
That's so cool. I envy that
tested,
about you. That's cool.
Yeah, I had three, I guess. I had a practice where I worked with parents who had problem children. Then I worked with a group of neurologists who referred people with mental health problems, dementia, and so on and so forth. And then, as I said, I worked in forensic psychology in the mental health board in Sarpy County.
Mm-hmm.
So I had the three areas that I worked with, but I did testing in all three areas.
And psychological testing is very in-depth, very complicated. And the reports at the end are quite lengthy. You give a lot of great information, don't you?
Yes. I had a battery of tests, of course, I used. The Wechsler battery of intelligence tests and the TAT and the I've forgotten some of them now, but
I don't think I even know some of them.
Yeah, a TAT is a thematic apperception test, which is a personality test. I use the MMPI test, personality test frequently, and others that I'm forgetting now.
Mm-hmm.
I use the Rorschach some, but I'm not a psychoanalyst, so
that was the ink spot, right?
Yes, that's right.
Yeah. As a social worker, I don't go that high. I don't do those kinds of things. Yeah. I do more advocacy and connecting to services, and then I will do therapy and some diagnosing, but not anything like what you've done.
Yeah, I did some therapy, but I was heavy on testing, diagnosis. Mm-hmm. Mm-hmm. And some very interesting cases that were referred to me by the neurologists, people who, were beginning to get Alzheimer's, or they had a number of infarcts that were affecting their ability to perform. Several doctors that I evaluated had gotten dementia, and it was sad to see that people who were very competent that had gone downhill like that. But I had to diagnose them and at least support the neurological diagnoses.
Exactly. What was it that caused you to go into the field of psychology?
Well, originally I was a minister, and I got my minister's ordination through correspondence, I guess you'd call it. But anyway, then I decided that I could not go very far unless I got a degree. So I went back to school when I was 25 years old. And while I was there, I was majoring in speech. And I took some ministerial courses, but I wasn't happy in that area. So I took some psychology courses, and I enjoyed them and enjoyed the professors. And so that just moved me into that area. Then I got a national education scholarship for 3 years to go to get my doctor's degree. And that was really what determined it, because I was given $3,200, and then the first year, $3,400, the second, $3,600 the next year. And back in the 1960s, that was a lot of money.
I was going to say, education's gotten a lot more expensive.
Yes, I'll say. When I started school, tuition was $10 an hour.
For the credit hours.
Yeah. So think of what it is now.
I got mine at KU at Lawrence, and I think it was $182 an hour, and that's been 2007. So it's been a while.
Probably considerably more than that now.
Yeah, it's interesting that you went as a minister, and then you moved into. So you've always been kind of called to help other people, haven't you?
Yes. Yeah, I thought I was called to ministry, but I don't know. When I went to college, I just kind of got away from that. I saw some things I didn't like in the ministry and some of the ministerial students, and I just moved the other direction. Into psychology.
That's cool. And you help people still. Let me ask you this. What if someone said to you, I don't have time for self-care? What kind of advice could we give them if they said, sorry, I'm too busy. I don't have time to take care of myself?
Yeah, well, they obviously need to take time because there are consequences of not taking care of yourself. And
I agree.
they're fooling themselves if they think they don't have time and they don't need it, because everyone does need to take care of themselves.
Yep. I agree. I have to agree with you entirely. One of the things that I've learned, certainly as I've aged and as I think about continuing to age, that there's probably nothing more valuable than my health.
That's right.
It's priceless.
You don't have good health, you can't do your job. Your immune system is down. You're subject to illness. You know, it's just everything can go bad.
Right. And I think finding that balance of being able to be busy and care for others, but also care for yourself. How they say you can't pour from an empty cup, so you must keep your cup full if you want to care for others.
That's right.
When I talk to people about self-care and therapy, I often encourage them to pick out things they used to like to do that they don't do anymore because they've gotten so busy. Some people paint, some people, like we said, garden, hobbies, different hobbies, but also even meditation, spirituality. If you're a person who likes to do meditation or read, but so many different things, kind of unique to each one of us, for sure.
Right. My wife loves to work on her iPad, and she especially likes to do that painting by number.
Exactly.
And it's very relaxing for her.
Mm-hmm. I've often found that the things that you can do that enhance and encourage all your senses, like if she's coloring on the iPad, she's seeing all these bright colors.
Right.
The coordination of moving her hand across the screen and painting it is a sense of touch. If you're listening to music while you do that, you have that sense of sound as well. So yeah, anything that we can do to involve our senses is often very replenishing, very helpful to us.
Right.
Very helpful to us.
Yeah.
What are your last thoughts? I mean, if you were to say, this is the most important thing I need to tell anybody who's watching about self-care, what do you think it would be?
Well, I'm not sure. I think all three areas, the physical, the mental, the emotional, spiritual, all of those areas are important. And to specify one, I'm not sure that I could say one is more important than the other. Probably the physical would be the most important if I had to say something, because without that, you're going to get depressed, and your spiritual outlook may not look right. So I think the physical, taking care of your physical and making sure that you can function well is the important thing.
I'd like to add my part to that, and that is you don't have time not to have time to care for yourself, if that makes sense. You must put yourself first sometimes, not all the time, but sometimes we have to be first as we take care of our own health, to be here for other people.
You're not much help to other people if you're not taking care of yourself.
Exactly. One of the things that I know that's very hard is being a caregiver in a community, and the advice that we might offer to those people just as well as your peers and friends in your community, because being in a senior living community, there are lots of changes. Oftentimes, if there's work in memory care, there's some energy and stress that it might be for different losses that people may see or experience, as well as the stress of how hard it is sometimes to do the work. Because sometimes under COVID, we've come into some situations where we struggle to find staff, things like that. So as a caregiver, we're also prone, we need to protect ourselves a little bit. We're also prone to giving away all our energy and caring for other people. And then we forget to do that. Because caregiving is a tough field, I think. It's a
Yeah,
very
yeah.
valuable field, but it's a tough one as well.
Yeah, it is. I'm pretty much the caregiver for my wife.
Okay, tell me
So
what that's like.
I spend probably most of my time with her and helping her. So I find it difficult in my situation to do much for others, probably not as much as I should. Rochelle does a wonderful job of providing activities and things, but so far I haven't been involved in them, although I probably ought to be more. But
Well,
as I
if
said,
you're,
I'm spending my time caregiving for my wife.
maybe you're doing just exactly what you're supposed to do, caring for her, being her partner. No, I think you're doing exactly what you're supposed to. And also, even more important for you then, not knowing that before we talked, is the self-care, taking care of yourself,
Right.
making sure you use your walker, because not having a fall would just put you back a little bit. I'm so
Right.
glad you're there for her.
Right. Yeah, that's the way I feel.
Yeah.
Yeah. We've been married 50 years in October, and so we're close.
Mm-hmm. The communities are really neat places, I think. A lot of people around, a lot of support if you need it, but also privacy if you need your
Yes.
privacy.
Yeah.
Okay.
We have a wonderful apartment, and we do have privacy there and everything we need.
Yeah. So maybe our advice to other staff and other residents is to make sure that you take a little bit of time each day to do something special for yourself, something that feels a little selfish. And the funny thing is it doesn't have to be very much. Maybe it's
Yeah.
sitting outside in the sun for 10 minutes
Yeah, right.
by yourself, you know.
Right.
So it's
Yeah,
simple things.
I see people here walking all the time, and I think it's wonderful. One person walks very fast and around the entire area several times. And I think that's wonderful.
Well, it's okay to be selfish just a little bit, isn't it? Every day.
That's correct. Yeah,
Yeah, that's what I think too.
I think so. Yes.
All right. Well, Richard, I have so much enjoyed talking to you and hearing your story. I definitely appreciate your time today. And I'm so glad that you were able to be with us and that
thank
you're a
you.
member of the Castlewood. So thank
Thank you. I enjoyed being here.
And I think to myself, what a